All right. Hello, everyone. It's Shauna from Positively Fit Canine Rehabilitation and Wellness. And actually, we're smack dab in the middle of September now. And September is Animal Pain Awareness Month. So, throughout this month, I'm focusing my attention with Positively Fit on all things pain related, especially recognizing pain in our dogs. Because in general, I don't think we do as good a job as we owe it to our dogs. So today I've got Victoria Blondin with me. She is the owner and operator of Shaggy Dog Pet Services here as well in Kingston, Ontario. I've had the pleasure of getting to know Victoria over the last couple of years, I think it's been. And if there is one thing I know, Victoria knows her stuff. And if she tells one of my clients that they should be doing that, I don't need to know why they should be doing it. I just need to tell them, yeah, Victoria said it. Just do what she said and it will all work out. So, welcome to Victoria. Thank you so much for joining me today. I was hoping that you could actually introduce yourself because I didn't know whether to call you a trainer or what to call you because I feel like you are a step above. Your background is a bit unique, and I feel like you could do better justice telling us about yourself than I could. So, I'll pass it over to you.
Yeah, for sure, Shauna. Thanks for having me. So I'm Victoria. I, as Shauna said, own Shaggy Dog Pet Services. My background is that I have a bachelor's in science, and then I have a master's in science as well from the University of Guelph. I graduated from my master's, and I think it was 2010. It's been a while now, and that was in animal welfare and behavior, as well as an emphasis on animal nutrition. So I actually worked with the Western lowland gorillas at the Toronto Zoo during that master's. I then went over to Edinburgh to work a little bit in a degree looking at veterinarian science, but I don't know. I got pulled back into behavior, so I don't own a stethoscope or anything like that. I guess they would consider me a pet behaviorist, but you're more than welcome to just call me a trainer, Shauna. Unfortunately, it's not a protected title, so
And that's a topic all into itself that we won't get
yeah,
into
we won't
here,
get into
but
that.
but it's a good point just for folks to know that there are dog trainers that have done something online, read a book, and there are people that have gone all the way to the levels you have with your master's background, your veterinarian training, even though you're not technically practicing as a vet. There's either extreme and then everything all in between. So, the reason that I asked Victoria to chat with me today is I think there's a huge intersection between what she does as a trainer, looking at behavior, and what I do, working more with, the musculoskeletal system, with the physical body itself, but both probably very much treating pain, but in different ways. So, I'm treating the physical pain that when I see the dog, the owner has recognized there's a pain issue. Maybe not so much when Victoria sees a dog, there may also be a pain issue. And likely a lot of the dogs that I see can benefit from seeing Victoria and vice versa. So that's the reason why I've asked her to chat with me today, because I think that with dogs, if I go to the doctor and something hurts, I can say it hurts here and I can point here and I can tell the doctor all about it. But for us to decide our dogs have pain, we need to look at behavior and read their behavior. And I know that I don't have as good a skills as Victoria has, but hopefully we're going to learn a little bit more about it today. So, Victoria, could you explain to us how pain in dogs might manifest as changes in behavior?
So it can be a range of things, to be fair. There's things that are overt versus subtle. The main ones, anyone's pretty good at spotting. Like the dog cries, they bark, they whine, they try to avoid the touch in certain areas. That's pretty clear. But obviously there's subtle signs too. So it can be that they don't play with their toys as much as they used to. This is a really common sign of dental pain. And 80% of dogs over 3 will have some kind of dental disease. And so, we want to be going to our vets, and that's why we go every year to make sure that they're up to snuff and it's not going on. You could have just a change in behavior, a sudden change in behavior. So I would say the biggest one is a sudden aggression where they didn't have one before. Space resource guarders is a big one. So so they suddenly are guarding their bed spaces or certain areas. About 50% of those cases are actually undiagnosed pain, and training can do very little until we get the pain under control.
Wow. Are there cases that you can think of where you went into it thinking it was really a behavior issue, and then as you got to know the dog, worked with the dog a bit, worked with the owner a bit, that you're like, oh, maybe there is something physically wrong with the dog? Like, does that happen often?
It's less likely for me. I would say more when I was first starting it, that could happen.
Mm.
And it's not that I'm special or anything like that, because like I said, I'm not licensed or anything. I use my master's for my behavior. That's what I do. But it's more that I have a pretty extensive intake form, and that's why I
Mm.
have the intake form. The questions that are on that like 40-minute form might seem like they're not giving any information, but I absolutely read every question, and it helps really guide where we should go in our introductory phone call. And many times, if I think there's pain just from the intake form, I'll guide them to their vet before we kind of even get started. And so when it does happen, obviously we'll make a call. So I had one case where there was just some attention, I will say, between the two resident dogs. The one kept annoying the other one, and that dog was getting annoyed by the annoyance, where they just kept licking their ear and things like that.
Mm.
I advised them to go and see their vet, and it did turn out that the dog that was being licked had an ear infection. So they were a little, and it was early stages, but they were a little bit annoyed because their ears were painful, and the other dog kept licking at the ear because they could smell the infection. The moment the vet helped us out and dealt with that situation, a lot of the behavior went away. We still had to do a little bit of redirection in the one dog and teach them place and things like that. But it went much more smoothly than if we hadn't had a vet involved.
Yeah. Do you mind giving a couple of examples of some of the questions on your intake questionnaire that might trigger, you to think about pain?
Oh, it's a hard one. Off the top of my head, obviously there's a whole behavior section, and anything they're
Okay.
kind of putting up in the behavior section. A lot of the background information about like where food is, how they respond to their food dishes, things like that,
Mm.
how they're responding to space. It really does depend on the individual dog and the individual situation that's coming in. A lot of those questions, it's not about one or two questions, it's about the whole form and how we look at it together. And then I'm like, that could be it. And from the form alone, I can't make that call.
Right. Yeah.
But when we talk on the phone, we'll lead more in that direction. The biggest thing I think would just be where, and there's one question on there about whether this behavior change was sudden or
Mm.
worsening over time. That's probably the biggest one for there might be a pain thing going on here. And it's always on the list when we have a sudden aggression, if you will.
Okay, yeah. And do you ever get pushback from owners when you're like, oh, this sounds like something that needs to be medically approached? Do you get pushback from owners, or are they pretty open to heading back to the vet?
I can say with 100% assurance that my clients I'm just really lucky. They're amazing. They're absolutely
Yeah.
amazing. If there's any like overt pain, they're usually already aware of it. And half of the time they're already got a booking with their vet, which is
Mm.
great. Responsible pet ownership, right? For the people that I'm bringing up for, they've no problem reaching out to the vet. They just, we're just it's what we have a relationship with vets for. So
Mhm.
and it's a great one to go for. Occasionally, they've already done that, and the vet might already be starting something, and so they're looking into training. The vets often will say, go see this professional or that professional, and often they'll reach out to me. And then sometimes I'll even send them to you, Shauna, because the vet's doing their best, I'm doing my best, but it's sometimes with these cases we need the whole team working.
Mhm, mhm. Yeah, we all have our areas where we've got a stronger focus, and that's where our background is. And I think one thing it sounds like you do similar to I do is that phone intake. And a lot of the times, just like yourself, I'll be saying like, this doesn't seem quite right. I do think you need to go back to the vet to, before you start working with me. So me, sometimes I think you need more of a diagnosis from your vet. Maybe there's an underlying, illness or something going on, or I think maybe your dog needs to be on pain meds before you're even coming to me, because again, all these things, it has layers, right? It's not,
Yeah.
oh, it's not simple black and white. We can't just, Tylenol and away we go. It's rarely that
Yeah,
simple.
and like if you just look up the definition of pain, they'll talk about the physical side of pain, but it also causes a psychological side, at least when we're looking at the definition for people. And I can't imagine it being that much different in our pets.
Absolutely. As a side note, we're going through issues with my son right now because he's had some stomach issues, but now he's got this whole anxiety about having stomach issues, which I think has now become worse than the stomach issues that were
Yeah.
there in the first place. So it's that feedback loop, right?
Yeah.
So what sort of training techniques might you use in a dog that you're suspecting has pain? And would that really change from what you're doing in your, practice with other dogs that maybe it's more purely behavioral versus there being a pain component? Does it change?
I would say that first thing I would say is that every time I work with a client, we'll start with a foundation. Things like the YouTube channels, like Zach George does a really good one. Michael Shikashio does another really, really good one at aggressivedog.com. But you know, those are great for foundations, but they don't individualize the program. And that's a benefit in working like one-on-one between
Mhm.
me and a client, or Shauna, you and a client too. You individualize it to the dog. That's what we're doing. And so when the pain comes up in that individualized thing, again, they're off to the vet or they're off to you. The training itself doesn't really change that much. It comes down to like the fancy term techniques I use are counter conditioning and desensitization. So we're breaking things down into really small, achievable steps, similar to what you would do for weight loss. Your goal is not 100 pounds, it's 1 pound.
Mhm.
And it's been shown in studies for people that you do much better if you have small, achievable goals, and you're much likely to lose the weight and keep it off. Again, not my area of expertise or anything, but that's kind of how it works in the dogs too. Small steps that they can actually achieve. How small? That depends on the dog. And so that's where the individualized
Mm.
plans come in. But we combine those small steps with something amazing. And again, what is amazing depends on the dog. That could be play, could be pets, could be attention and praise. And oftentimes it is food because these are dogs.
Mhm. Mhm. Absolutely. I love that. Um, When when you so let's say you've gone through that initial phone consult, you're now working in person, you're seeing how that dog is acting with you now in their space. How are you broaching that topic of pain, or what are you saying to an owner? And I imagine this depends on the dog that's in front of you, but are you saying like, are you identifying the body part that might have pain, or are you leaving it more open-ended? Like, how are you approaching that conversation?
So it depends on, again, kind of what's going on. Like if I'm seeing a dog favor their leg or things like that, or they're kind of what we call toe touching. So not putting a lot of weight in there, or I see a lameness and we score lameness in levels. If I'm kind of seeing that, I'll try to point that out to them. I'm a big fan, and I know you are too, Shauna, of them having like videos of normal and updating them every year, especially of a dog in a walk and a trot. So not just a trot, just because of how their brain works. That can be very autonomic for them. So we want to have a walk and a trot, so that if something goes wrong, then we can update that video and show our vets both of them. So that goes a long way. Not just with the aging dog, but with a dog that, suddenly they've hurt their foot. Maybe, I don't know, they walked on a bit of glass or something on their walk, and that's something we want to be aware of. So yeah, I think that I would point it out if it was very obvious, very clear, but I'm not a vet.
Right.
So I don't want to go and say, oh, it is obviously this, this, and this, because that would be practicing vet med without a license. And that is
Yeah.
illegal, everyone. So and so I'll say, look, I think this might be pain, or there might be something else underlying going underneath. I think that you should book a consult specifically for this particular thing with your vet, and
Mhm.
just let's get them cleared. And we're very lucky in Kingston, and I go all the way to Trenton as well. So we're very lucky in Kingston, Trenton, and Napanee. We have some amazing vets here, and they're very good at what they do. So they'll definitely, they're more than happy to help us out and make sure that the dog is healthy and fit.
Yeah, absolutely. And I think one thing that you've really touched upon without saying it, that, and I mean, I'm probably repeating myself, but we've all got our roles. And even though you have an education background for veterinary medicine, you are not licensed, or whatever the proper term is in Ontario, to practice veterinary medicine. And that can only be your vet at the clinic. How, and maybe you really have answered this, but if there's not an overt lameness, if there's not that quick change in behavior, are there any other signs or cues that really help you as the trainer distinguish that pain versus fear or anxiety? Or again, is it putting all those pieces together? Are there any like real clues?
It's a really good question, and I wish it was easier. And a lot of my clients have heard me say this, that if I could talk to your dog, you'd be spending a lot more money on me, but the dog would be fixed in an hour.
Yeah.
So it would be money well spent. And that would be an awesome skill to have. And there's many a fantasy book written about it, because we'd all love to have that skill, especially us pet lovers.
Mhm.
But I think with a lot of this, it depends on why they're coming to me. Obviously, I'm not as concerned about that in obedience cases, but that's not to say that I haven't picked up on it in obedience cases. So for example, a dog chewing things, this is actually more of a cat sign, believe it or not. If a cat's really like chewing at thing, that's dental pain. So for anybody with cats, just watch out for that. Obviously, if it's a sudden chewing, if they're constantly chewing things since they were a kitten, that's probably normal. But sorry, guys. um,
But Victoria maybe can help with that.
yeah, yeah. Well, the vet can. But yeah, it would just be a case of there's sudden changes, and kind of like your standard operating procedure, if you will, is I want to rule this out, so I'm going to send you to your vet. And if your vet's already seen you, as I alluded to before, we might send you to Shauna as well. That doesn't mean we need to necessarily stop the training process. We'll just adjust the steps. So for example, if it's a dog with neck pain, and we're eventually going to have to work anyways, but I might just work with them standing at a distance and reaching towards the dog, and then following that with a treat. And we just do 10 repetitions once or twice a day, 5 times a week. And if they like their kibble, you can use your normal kibble for that. But we wouldn't get too much further until everything's been cleared and the dog's doing better. And as we talked about with the definition of pain, there's a physio or a psychological side to pain. Anybody that's been in chronic pain can tell you that there's this psychological side to it. And so even if they've been fully cleared by their vet, a lot of my cases actually come in, they've already been treated by their vet, and they've already dealt with the pain, and the dog's on the other side of it, but the behavior doesn't go away. And that's because it's now become a learned response. And for example, the neck pain example, the dog's scared to have them reach towards the collar. One example I have from one of my friends who runs a training hall up in Peterborough. So Cindy at a Team Fido Dog Training, one of her examples is that she had one dog that they got nailed by a porcupine. So they got hit. And then people were grabbing for the collar to try to take the dog into the vet. And after that, they had that response. And I've seen it for other cases myself for some of these dogs, though not related to porcupine. And so we really push in our puppy classes what we call the collar touch. So teaching dogs that when you reach towards the collar, that good things happen, amazing things happen. So in that case, after the pain's dealt with, because it's limited what we can do. We want to desensitize, not sensitize. So if we're reaching towards the collar and the dog's in pain, we're teaching them that means that bad things are going to happen. So we have to deal with the pain first. And then we would start approaching and doing the desensitization steps. I guess it would be a response to training as well. Now, ideally, we would pick it up before then, but nobody's perfect, including myself. I'll totally own that I make mistakes, and I just try to learn from them and get better. That's why I do continuing education. But if I'm noticing the dog not responding the way I would expect them to in this case, then I might send them back to their vet and be like, let's just double check. Let's just make sure,
Yeah.
because the dog's not responding the way they should. And that information on its own can be taken to the vet.
Right. I don't know if you get asked this by your clients or not, because and I get asked it all the time. They'll say to me, like, when you come, do you want Peaches or whatever the dog's name is to not be on their pain meds when I come so that you can really get a sense of where their pain is at? And for me, my answer to that question really depends on how high of a pain we're talking about. Do you get asked that question?
It's a pretty common question. A lot of trainers will agree to this one. It's a pretty common question to like, the clients want to show you the behavior. I don't really want to see the behavior. I don't want to stress out a dog so that you can get a video. So I see this most
Mhm.
with reactive dogs, but also with separation anxiety dogs. People want to show me what they're like and to
Right.
camera on them for that. Every time they go through this scary event, whatever it might be, the behavior gets worse. And my
Mhm.
job's to do the opposite. And the way I train, we go sub thresholds. We want to keep the dog sub threshold. So there's not fear and anxiety. There might be a little bit. Life is stressful. There's going to be frustrations, and we need to build frustration tolerance into the dog. So we are going to add a little bit of pressure, but we want to make sure the dog's ready for that. And that comes down to body language signs, which we won't get into that because we could talk for like 5 hours about body language in dogs. But yeah, we just want to make sure that we're kind of ready to move forward. I don't
Mhm.
want to see the behavior, but a lot of people already have videos. I have
Mhm.
an assessment session specifically to look at the separation anxiety that will keep them much more sub-threshold, and we can pull the plug before it ever becomes panic. The intake form I mentioned before, that's really important for me from a point of view of reactivity. What they put down, just like when you go into the vet clinic, history is probably one of the most important things.
Mhm.
So the history, I believe you when you like, people aren't going to tell you that my dog's biting.
Yeah.
Like they don't
They're more
want to.
likely to hide it,
Yeah,
right?
yeah, they're more likely to hide it than they are to cut. So when somebody says that, oh, my dog's never bitten, but I've maintained, distance and I have a leash, but I absolutely believe you would if you got close to a dog. I 100% believe you. Like, we don't
Mhm.
need to put them in front of a dog to
Right.
see that.
Right.
Or even a dummy dog. I believe you. We need to go through the steps of, there's a lot of steps to do before we even get them in front of these things.
Mhm.
So yeah, it does. It does happen in that regard. As far as the pain meds, not as much, because generally that's more your field and the vet
Mhm.
field. So
Mhm.
whether they see it or not, I couldn't say, but for me, it's more wanting to show me the behavior.
Yeah.
I would rather get a history of it. For some of these cases, we'll see it eventually, but I want to see it at a lower level.
Yeah.
Ideally, not at all, but
Yeah. Yeah. And a few themes that I've picked out of what we've said so far, one being absolutely knowing what your dog's normal, you know, is or was, whether it's through video, through memory, which can be a little less reliable, but if you've got notes or things like that, but some sort of record keeping, because our memories can be so unreliable. That's why, I mean, the advent of the smartphone has been lovely because everyone's got a video camera in their pocket and probably has taken some film of their dog at some point. We've got that. And then the other thing I was going to say has totally evaded me. But it will come back to me, but it was a really smart point, I am sure. Um, I was wondering, Victoria, if you might be able to share a story or two of dogs that you've worked with that have had pain, but also behavioral issues, how they've gone in like the Reader's Digest version, and probably a positive outcome, I would imagine.
hopefully we can't pick small, but
Yeah.
we do our best to get that number in our favor. Um, I mean, I already alluded to the one with ear, so that was one example we could go for. And that the moment we got the ear infection under control, it was a lot easier to teach the younger dog not to annoy the older sister. 100%. Another one I can think of is skin issues. Skin issues. They're by far the hardest thing for all of us to try to deal with. And we had one dog with just really severe separation anxiety, and they never really seen much improvement. And they already were seeing their vet and things like that, but when they started to see a specialist and things, and we got the pain and the skin
Mm.
under control, then we started to be able to motor through the program, and they were doing close to an hour, and it took them a little longer to get there. The dog has, in this case, a bit of generalized anxiety as well.
Mhm.
And so, we're working with our vet, and we're working a vet behaviorist as well. Vet behaviorists are like the specialist, and if you can go and see them, 100% recommend that. I can work the ground and work the everyday training, but seeing them can make such a huge difference on that everyday training.
Mm.
But yeah, once we did that, we started to see some pretty steady, slow but steady improvement. And so that's in this case, with the severity of this dog, it's an amazing outcome, and they're continuing to see improvement forward. Then I guess the other example would be the space resource guarders that I mentioned before. We don't do the training while they're in pain. We set up areas where they can get a lot of distance. The number one rule is that you don't enter the space. But when we got the pain under control, then the training was actually able to do what we wanted from it.
Mm.
And I would say that this training, obviously we're adjusting for the individual dog, we're building individual plans, but if the training's not going the way we're expecting it to go, then we want to visit the medical side, what might be going on.
Absolutely. And that's so similar to what I do, where, I can be pretty certain about or feel pretty confident about a certain, musculoskeletal dysfunction. But if, the dog's not getting better, like I would expect to, knowing how tissues heal, then I like absolutely like go back to the vet. Like we need to look deeper under the surface for what's going on. Um, oh my, and again, I've lost my train of thought.
I
I
think
know
it brings up a really good point, though, that we're not here to fight against vets, we're here to work with them.
yeah,
And I have seen huge improvement in this, but it was like in 2010, 2015, it was a lot of like trainers versus vets, which is it should be trainers with vets.
yeah, yeah, absolutely. The other thing I was going to say, and it really brought it to mind when you were talking about the skin condition, dog. Just like even if when we think about like having the flu or just feeling unwell, and then let's say you felt really crummy, like you get the aches, like you're just tired, and then you're supposed to go out and interact with society, like
Mm-hmm.
you're not going to be pleasant if anyone tries to come up and talk to you. So I can imagine, our dogs are going to feel the same way, like get out of my space. Yeah. Yeah. Um, Are there any, for, because this is such a vast field, like we're just kind of scraping the surface a little bit. If there were owners that were really interested in maybe diving a little bit deeper, they don't want to get certified, they still would go to someone like you, but they just wanted to kind of scratch that itch of knowing a little bit more. Are there some places that you trust the information and sources that you would send folks to?
So I think if you're looking for like the pain versus behavior, there is a really good blog by the Whole Dog Journal. So you can go to their website, and it's by Jessica Heckman, who is a veterinarian, so DVM. And the title of it is Pain's Effect on Behavior. So that's a good kind of scratch the surface kind of starting one. If you're looking for something a bit more in depth, then I'd look at whatever behavior. Like we talked about how some of these YouTube channels are really great, but some of them are really bad. And so we have to be careful about where we go and who we listen to.
Yep.
Dog Wise is basically it's kind of like a Chapters or an Amazon, but it's specific to science-based methods in dog training. Anything by Patricia McConnell, so it's Dr. Patricia McConnell. She's a PhD dog behaviorist. So anything by Dr. Patricia McConnell is going to be great. Pat Miller, Beware the Aggressive Dog, her book is. That's a really good one. And then things like the book Mine or Fight, depending on what's going on. I mean, obviously, if you don't have dog to dog aggression, you don't need the book Fight. But if you have a resource guard, or Mine can be a really good book as well. And these can all be found on Dogwise.
Yeah, and I'll get the list from you, Victoria, and I'll post them below the video so that if anyone wants it quickly, they can find those names and the spellings of those things. So to kind of wrap it up, for Animal Pain Awareness Month, obviously we've been talking more specifically about dogs. If you could list 3 things that you would like owners to really reinforce or to know this month, what would be your top 3 things?
I think the number one thing is that pain causes fear and anxiety. So if we get on top of the pain, that's the number one job. But then we may need to do some training and some sessions, even if it doesn't look like our dog had any long-lasting effects. This is something that's been shown actually on the trainer side. If we get bit by a particular breed, you'll be fine to get through that and get that breed, that particular dog trained. But the next time one of those breeds come in, you might go slower. And you might take longer to get them to the same spot that you got the last one, for the simple fact of this psychological, and we don't even know we're doing it. It's an underlying fear now that's there that the trainer has to work through. And rule of thumb is not to get bit by the dogs. If you're working with a good trainer, they don't have this like extensive bite history that they like to throw out. We're trying to prevent dogs from bite, but it's an example, and the same thing's going on in dogs. So like with the porcupine example or the neck pain example, maybe we'd want to do a one-off just to do some collar touch and make sure the dog sees that in general it's a positive thing. It's a fancy term, but it's called classical conditioning. So we just want to make sure our dog still sees that as more positive than negative. And then not all pain is clear. So those subtle signs, and this falls down into the body language signs, but we really need to know the levels of body language. You can look up the BSAVA, so British Veterinary Society or Association. They have the aggression ladder, and it takes you up kind of a ladder. Dogs start low. It's things like licking their lips, turning their heads away, things that seem so subtle to us, but in the wrong context or right, they mean distress or they mean discomfort. And so knowing those levels before the big, what Michael Shakashio would call macro signs, those are the ones that we're all good at spotting, where the dog's lunging, whining, trying to run away, big macro signs. There's levels before that. So knowing how to read your dog so that we can read those subtle signs of pain is really essential. And yeah, I guess I know that's only 2, but I think those are kind of the main 2. That I guess the third one might be that pain needs to be treated by the vet. And yeah, there's supplements like yourself, Shauna, which are like there's no replacement for that. You do an amazing job at what you do. There's no question there. I have no problem myself sending a client to you. I know they're in good hands when they go to you. But we need to treat that pain first, because it's going to be a wall between my training and your dog's ability to pick up that learning, because it's going to sensitize them to bad things happening when we try, unless we can deal with that underlying cause, which is the pain.
Absolutely. And from my point of view, from a physical rehabilitation perspective, the dog's in too much pain, a muscle doesn't work. So, I mean, the pain is blocking, like it's this wall between like where you are now and where everything else you would like to see. So it has to be addressed. Absolutely. And I'm just going to add, you can't wait it out. Like, it's not like waiting out your cold to go away. Like, there needs to be action.
These behaviors tend to get worse rather than better, even once the pain's gone. And there's the occasional dog, and you'll hear about, well, I didn't need to train my dog. No, it was fine. They got over it. But how many dogs didn't? And we don't really have, to my knowledge, and I could be wrong, and I'm okay to be, if you can prove me wrong, I love to see the study, where, a lot of these, behaviors like fear, anxiety, and things like that have been related to a pain event.
Absolutely. Thank you for that. I think that's just so valuable. And it would make my day to never hear an owner say, "Oh, my dog's not in pain, but they're on three legs. They're carrying on just fine." And I'm sure there are things that you hear day in and day out, and you're like screaming on the inside, "They're not freaking fine." And I want that not to be okay anymore. So
Yeah.
I'm really glad we have this National Pain Awareness Month to just really focus in on this topic and educate and do better by our pets, because that's what we
Yeah.
all want as really good animal owners.
Hmm.
So my last question for you, Victoria, is if anyone wants to find you, where do they go and look for you?
So you can reach out by email. So shaggydogtraining, all one word, at gmail.com. I also have a website so you can have a peruse around. If you've got a separation anxiety dog, there's actually a little bit of free training on there just to get you kind of started and see if that helps. But it would be www.shaggydogpetservice.com. And you can fill in that big intake form there right on the front page. If you decide, you know what, I want to book a phone call, then you can fill in the intake form and it will automatically take you to where you can book a call with me.
Perfect. And I know we didn't work with the same dog, but two dogs under the same roof, and this
Mhm.
younger dog that they adopted. And I think
Yep.
that's the first time actually, I think she found out about you because I shared one of your resources on social media. But just the change in this dog where she could not leave the house to being able to leave this dog all day. Like it's just,
I
I
know
think
which
the
one you're
view is
talking about, and
amazing.
they're
Yeah.
just lovely, and yeah, she's come such a long
Yeah.
way. It is definitely our gold star
Yes.
star case with
Yes.
star clients. So,
Absolutely.
but
We're
aren't
very,
they all? Like I honestly can't think of a bad client that I have. Everyone's pretty amazing.
yeah, I agree. And same with my case. So we're lucky to work with the folks that we work with. So thank you so much for Victoria for taking the time to do this, to give us some education. I have actually learned a lot, and I need to go look at some of those resources because I can always learn more. And what you said about the trainers having fear of being bit, by a certain breed. I know there is a breed, and it is not a big, it's a small breed. I've only been bit once at work. And
I'm
now
not gonna
every,
pick on a breed because it's about the
nope,
individual dog,
yep,
but
yep. And he made me bleed a little bit. Like I didn't need any wound care or antibiotics or anything. But now every time I work with a dog of that breed, I'm just like, okay, Shauna, make sure you're really watching. Like I am heightened awareness. So I really, really
yeah,
live
I
into
think
that.
like the worst bite I ever saw, it wasn't from a large breed and it wasn't from any of the breeds that get labeled as bad and they're not bad at all. But it came from it was a mixed breed, but it came from a dog about the size of a Cocker Spaniel. And like the person had to go, it wasn't me, but the person had to go to the emergency hospital after that bite. And I was like, so don't count out those little guys. They got spunk.
Oh yeah, and they're fast.
Yep.
All right, guys, I hope you enjoyed it. If you have questions, do let us know. I will keep an eye on the comments, and I'm going to post all the links and resources that Victoria mentioned so that you've got it at a glance. Cheers, guys, and we'll talk to you later.
Bye.